Hello everyone. Welcome to today's live presentation. Today I'm going to speak on a little different topic, and that is, why do Gynaecs suggest lymphocyte immunization therapy or LIT? Isn't it an unusual topic? But yes, of late I have come across this many times, so therefore I felt I must address this issue because I was going through the record of all our patients who have undergone lymphocyte immunization therapy at our center, and I realized that majority of these patients were referred by gynecologists or IVF specialists. So that made me thinking, why do these gynecologists refer patients for lymphocyte immunization therapy, and in which conditions they must be referring, or what is the need for them to refer these patients for lymphocyte immunization therapy. While I was going through this record, I saw a few of our patients. There was one patient who was referred by an IVF specialist. The patient had history of 5 unexplained miscarriages. So the patient thought that IVF will be beneficial for them. So the couple had seen a leading IVF specialist, and the doctor said, see, you have 5 miscarriages, all the reports are normal, they are unexplained miscarriages. If I do IVF for you, you are going to conceive again. But what is the guarantee that this pregnancy also will continue? Because we don't know the cause why it is failing. So it is important that we must find out the factor which is responsible in your case, and then it will be easy for you to go ahead with pregnancy. And this patient was referred to our reproductive immunology center, and she later on got investigated. She had immunological cause, and so this patient was referred to us for LIT. There was one more patient who had 4 IVF failures. She had never conceived, a patient from Assam. And when she saw a new IVF expert, the doctor said, before going ahead with next IVF cycle, we must rule out immunological factor. So the doctor did all the tests. He found out that patient had an immunological problem and was referred for lymphocyte immunization therapy or LIT. I remember one more patient who had endometriosis. She was treated completely with endometriosis. Still, she was not conceiving. IUI was not successful. So the IVF expert was going to plan an IVF procedure, but the doctor thought that she might have another factor responsible. So the doctor investigated the couple, found out that she had immunological cause, and she was referred for LIT treatment. So there are many such patients who had unexplained reproductive failures and were referred for lymphocyte immunization therapy or LIT. So friends, I am Dr. Mohan Raut. I am a gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut's Centers for Reproductive Immunology, in different parts of India. Our main center is in Mumbai, and we have also centers in Nagpur, Pune, Bangalore, Hyderabad, and Delhi. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using immunomodulatory treatments, especially lymphocyte immunization therapy, which is also called as ImmuLIT or ImmuLIT at our center, because it is the patented form and branded form of lymphocyte immunization therapy that we practice at our center. And this ImmuLIT is followed by a protocol of immunomodulatory medications depending on the immunological reports of the couple. Now, coming to why doctors are feeling the need to refer patient for immunological treatments, because all of you know that the problem of reproductive failures is universal, or it's very common, and it includes repeated miscarriages, recurrent IVF failures, and unexplained infertility. Now, if you consider, say, repeated miscarriages, then you all know that in almost 50% of couples who have repeated miscarriages, the exact cause cannot be found. They are labeled as unexplained, and then they are advised either more advanced treatment like IVF, or they just go from one doctor to the other and experience more miscarriages. While there are certain group of a group of patients who undergo repeated IVF cycles and they don't succeed, landing in recurrent IVF failures or recurrent implantation failures to be specific. And in these couples also everything is normal. All treatments have been done. The embryo quality is good. Many times PGTA is also done to select the genetically normal embryo. The lining is good, the cavity is good, but in spite of that, the patient does not succeed and ends up in recurrent implantation failure, and then there is no cause found. So it is in this group of unexplained recurrent implantation failures or repeated miscarriages that it is important to find out whether there is an immunological cause. Okay, so that's why there is a need to consider an alternative diagnosis, and especially the immunological diagnosis in these couples who have unexplained reproductive failures. And in these so-called unexplained reproductive failures, that is repeated miscarriages or recurrent implantation failures, there is the high possibility of an immunological factor, to be specific, what is called as an allo-immune factor. And why so? Because all of you know that pregnancy is 50% from mother, 50% from father. The part which comes from father is totally different to mother's body. So the pregnancy is immunologically and genetically different from the mother's body. So logically speaking, there should have been immunological reaction against pregnancy also. But that doesn't happen. Pregnancy continues without any problem. And why so? Because pregnancy has a special immunological protection in mother's body through what are called as the protective antibodies or blocking antibodies and certain type of protective cells called T regulatory cells. And this is how the pregnancy is protected. And in some patients, this natural protection doesn't function properly. And so as soon as there is pregnancy, there is an immunological reaction which starts. When the reaction becomes maximum, the growth of the pregnancy stops. If this reaction is little delayed, then there is conception followed by miscarriage. If this is very early, it will lead to implantation failure or preclinical miscarriages. So what happens to these patients if they are not diagnosed about their immunological factor is that these patients then actually go, as I said, go from one center to the other, and they are given different medications. But in spite of that, they don't succeed. And finally, many a times they are just left to nature. They are told next time when they conceive, they can come, we will start more medications. But in these so-called unexplained patients, there is an immunological factor, and that's why now more and more gynecologists and IVF doctors have realized that this immunological problem exists and it can be corrected by immunomodulatory treatment, especially lymphocyte immunization therapy or ImmuLIT, and followed by immunomodulatory medications. So I was just thinking why these doctors feel the need to refer. So I was just thinking the first and the most important point is the doctors are in their practice. Every gynecologist will have a few of these such patients who say of repeated miscarriages whom they can't offer any solution. So in fact, these are some of the patients which a doctor feels if they don't come to their clinic, it will be better because I can't provide a solution for them. So these so-called difficult to treat patients are there with every gynecologist. Every IVF expert has a group of patients who have been difficult to treat. They have been failing repeatedly in spite of doing everything for them. So, and they can't offer any solution to these patients. So, therefore, they think of anything else, any other factor, and therefore, immunological factor is considered, and then they take help of clinical reproductive immunologists. Second is now there is an increasing awareness about the immunological factor or the allo-immune factor in such unexplained reproductive failures, because there are now increasing discussions on this topic. Various conferences in obstetrics or gynecology discuss this topic regularly. There are sessions planned, there are workshops planned on reproductive immunology, and even in conferences of IVF doctors, like the ESAR conference or the regional ESAR conferences, now there are workshops conducted on clinical reproductive immunology, and therefore more and more doctors are getting aware about this reproductive immunology factor, the allo-immune factor, and they are recommending their patients immunological treatments and taking help of and sending for lymphocyte immunization therapy. So that was the second factor. Then the third thing, important thing is the doctors have becoming aware that now there are investigations which can help us to select couple who will be benefited by the immunological treatment, because that is the biggest challenge before, at whom to give immunological treatment. Yes, I know this patient may have immunological factor, but then what? So now there are certain investigations which help us to select couples who will be benefited by the immunological treatment. For example, in case of lymphocyte immunization therapy, if the lymphocyte cross-match is negative, if the natural killer cells show certain changes with more natural killer cell activity, or there's increase in inflammatory cytokine TNF alpha, raised antithyroid antibodies, these are the couples who will be benefited by the active immunomodulatory treatment of lymphocyte immunization therapy, and followed by passive immunomodulatory medications. So that is because of the investigations. Now, what doctors are doing, gynecologists and IVF experts are doing, that they are making these investigations as part of their investigative workup. For say patients who have repeated miscarriages, the protocol includes immunological tests. For patients who have recurrent implantation failure, the investigative protocol includes the test for immunological factor. So the doctor comes to know, yes, this patient couple has immunological problem and will be benefited by the immunological treatment of lymphocyte immunization therapy followed by immunomodulatory medications. Then after diagnosing it, the next thing why they refer patients is that now there is availability of dedicated centers which work in the field of reproductive immunology with internationally recognized clinical reproductive immunologists. One example is our own center, Dr. Raut's Center for Reproductive Immunology, where we do dedicated work related to clinical reproductive immunology only, and we help couples with the problem of repeated miscarriages, recurrent IVF failures, and unexplained infertility. And so doctors are preferring to refer patients where a dedicated work related to reproductive immunology is done. Then, so at our center, as I said, we have a patented branded process of ImmuLIT, which is an active immunomodulatory treatment which can be useful for these couples. ImmuLIT is a one-time 3-hour procedure, and the timing is not related to periods. After selecting couple with the immunological test, the treatment can be done as a one-time process, as I said, followed by a gap of 4 to 6 weeks, and then the couple can plan pregnancy whichever way that is required. In case of miscarriages, maybe natural pregnancy conception, or those who have require IVF will undergo subsequent embryo transfer, and that way the patients can be benefited. So the doctors who have referred patients for these treatments to our center, they have experienced that the success of this procedure. Many of their patients have been successful, and that makes them to suggest this treatment for more of their patients to undergo the treatment of lymphocyte immunization therapy or ImmuLIT, and these patients are referred to our center. A special mention has to be made about the IVF specialists, because they treat patients who have already gone through a lot of treatment for fertility. When they undergo IVF cycles, and if they don't succeed, a couple goes through multiple IVF cycles. IVF cycles, to undergo multiple IVF cycle is tedious, it is exhausting, it is physically, mentally tiring, and also financially, the burden is too much. So for especially IVF doctors are looking for ways where they can help patients succeed soon, or without landing them in recurrent implantation failure. So in such patients, they are thinking about the immunological treatment, and that's why they are now suggesting lymphocyte immunization therapy more commonly. So here one interesting thing was many doctors refer to our center, so we interact with them. So we ask them, "Ki, why don't you do lymphocyte therapy yourself at your center?" And they are saying, many of them told us that this is a specialized procedure. It is better that it is done by, say, in the dedicated reproductive immunology centers by clinical reproductive immunologists who are qualified, and therefore they prefer to refer these patients to the dedicated centers rather than trying on their own in their own centers. And they say we are busy with our own work and we don't have time for this dedicated reproductive immunology work, and therefore they have been regularly referring these patients for lymphocyte immunization therapy to our centers. Here, before I conclude, I would like to say one more thing, that why these gynecologists refer to us, or rather when they suggest to us, there is one more important thing behind this, and that is evidence-based medicine. Now I would like to say a few things about evidence-based medicine also. Now, evidence-based medicine is defined as the medicine which the medicine that is practiced depending on the evidence which is there by the clinical studies. So that was the old definition. Now, evidence-based medicine has three components. One component is the research evidence. The second component is the clinical evidence, clinical experience of the clinician, and the third component is the patient's preference. So all three components, the research component, the personal experience and patient's choice, are included in evidence-based medicine. And when you are combining all three factors, then only then you are practicing clinical evidence-based medicine. So yes, as I always say, the doctor who follows the guidelines to the T 100%, he knows, he or she knows about the research details, the result of their practice will be really good. But someone who knows everything about the research evidence, also includes his own personal clinical experience to this, and considers patient's choice along with that, that doctor will have definitely better success rate than someone who just does 100% following guidelines. So therefore it is important to include our experience in our practice, because finally it is this practice that is generating the evidence. So therefore, if we consider all three, then we are doing justice to our practice. So therefore, in patients who have unexplained failures, miscarriages, implantation failures, or unexplained infertility, it is important to consider holistically what possibly can help a particular couple so that they can fulfill their dream of having their own baby. So, if you have any queries about this, you can always contact us on our helpline number, that is 9833201522 or 9833201544. And we are always there to answer your queries and help your patients achieve their dream. Thank you.